The temporal bone, os temporale, is a paired bone that creates the lateral part of the neurocranium. It has 4 subdivisions. The biggest is pars squamosa that has or extends also on the inferior surface and comprises the structures pertaining to the ATM, the temporomandibular joint. Also, it has this extension, which we call processus zygomaticus, that together with the zygomatic bone creates arcus zygomaticus. Posteriorly, it has pars mastoidea, the mastoid part, that is in contact with the occipital bone. And then between pars mastoidea and pars squamosa, we have this little pars tympanica, the tympanic part. The 4th part, pars petrosa, is only visible over a small segment on the inferior surface of the skull. The contact margins are as follows. We have a long contact with the sphenoid bone all the way here. This is the ala majorosis sphenoidalis, the greater wing of the sphenoid bone. So this margin is called margo sphenoidalis. Then we have a long contact margin with the parietal bone. Obviously, this will be then margo parietalis. And then we have a contact margin of the mastoid part with the occipital bone. So this is going to be the margo occipitalis. For the details of the temporal bone, I'm going to use an isolated specimen, a right-sided temporal bone. For reference, here you have the skull to compare the position of the temporal bone. As you can see, this is the petrous part, pars petrosa, and then the pars squamosa, squama temporalis right there, and so on. So this is the relative position of the bone within the skull. The petrous part has a triangular pyramidal shape, which has its apex oriented anteriorly and medially, and the base outwards, and it has 3 surfaces: the anterior surface, the posterior surface here, and the inferior surface right there, with 3 margins separating them: the superior margin, the inferior margin, and the posterior margin, and the anterior margin right here. The surfaces are as follows. We will have the anterior surface with towards the apex with a depression, impressio trigeminalis, which holds obviously the trigeminal ganglion. Then close to the superior margin, we will have this eminentia arcuata, a protrusion created by the superior semicircular canal of the inner ear. And lateral to this eminentia, we have a area called tegmen tympani, which is practically the roof of the tympanic cavity. It's right here. Now, if we look from anterior, we can see 2 little openings here. This superior one is hiatus canalis nervi petrosi majoris, and the other one is hiatus canalis nervi petrosi minoris. They both continue into their own grooves, sulcus nervi petrosi majoris and sulcus nervi petrosi minoris, heading towards the apex of the petrous part. Now, the border, the margin separating the anterior surface from the posterior one is margo superior, that has this groove along it, which is called sulcus sinus petrosi superioris, that holds a venous sinus that ends in this big venous sinus, which we call sinus sigmoideus. On the posterior surface of the petrous part, we have this opening, the porus acousticus internus, that continues into a tunnel, the meatus acousticus internus, which is practically the internal auditory canal, ending in the internal ear. Under eminentia arcuata, we have here fossa subarcuata, and lateral to porus acousticus internus, we have apertura externa aqueductus vestibuli. All the way in the back, already in or on the mastoid part, we have the large sulcus that belongs to the sigmoid sinus, sulcus sinus sigmoidei. On the inferior surface, we have several smaller features that need finer attention. So first we have this big tunnel, canalis caroticus, that holds the arteria carotis interna in it, and it goes all the way towards the apex of the pars petrosa, as you can see here, like so. Then inside canalis caroticus, not visible here unfortunately, we have the canaliculi carotico-tympanici, small little tunnels that lead into the tympanic cavity. Behind canalis caroticus, we have this fossa jugularis for the superior dilated part of the internal jugular vein, which has this little opening right there, which is called canaliculus mastoideus. This one, and it holds a small branch of the vagus nerve. Between the fossa jugularis and canalis caroticus, there is a small triangular area which we call fossula petrosa, and in fossula petrosa we have two openings, canaliculus tympanicus and canaliculus cochleae. Canaliculus tympanicus here has a nervous branch called nervus tympanicus from the glossopharyngeal nerve. Then we will have a metallic rod, unfortunately, inserted in the so-called foramen stylomastoideum, which is called like so because here we have the processus styloideus, which is broken off from here. It should be longer, like processus styloideus here, and in the back we have processus mastoideus. So this area, this foramen, this opening, is going to be called foramen stylomastoideum. It's the exit point for the facial nerves, tunnel canalis facialis. The apex of the pars petrosa eventually holds some more interesting areas for us, and that is practically the opening here, which, as you can see, is headed or points anteriorly, like so, and that is the canalis musculotubarius, which is visible from anterior, like that, and it is heading towards the middle ear into the tympanic cavity, holding two half tunnels, which are not visible obviously in this specimen, the semicanalis tubae auditive, or the eustachian tube, and also the semicanalis musculi tensoris tympani. But if we put the pointer in the tunnel, canalis musculotubarius, we can see that it's visible in the middle ear in the tympanic cavity through meatus acousticus externus, right here. Now, the pars petrosa's two other margins, the inferior margin, the posterior margin and the anterior margin, go as follows. The anterior part of the posterior margin here is in contact with the pars basilaris osseus occipitalis, and together with that it creates a synchondrosis, which will eventually be like a fissure. So this is the synchondrosis right here, and then we will have the incisura jugularis, the jugular notch right there, with processus intrajugularis, which is similar to the occipital bone's jugular notch. They together will create the foramen jugulare. The anterior margin right here comes into contact with the sphenoid bones, greater wing, and that is again creating a fissure, the fissura sphenopetrosa. This one was the fissura petro-occipitalis, and this is the fissura sphenopetrosa. And between the body of the sphenoid and the greater wing and the tip of the pars petrosa, we will have an opening which we call foramen lacerum. Now, this is the pars petrosa. As we continue on with the pars squamosa, it has two surfaces. The internal surface, cerebral surface, is just has these sulci arteriosi, the arterial sulci. On the outer surface, we have some other features. obviously we have the big protrusion, which is called processus zygomaticus. That means the zygomatic bone to form the zygomatic arch. And this processus zygomaticus will attach to the rest of the bone via two roots. One of the roots is the anterior root, and the other root goes all the way posterior here over the meatus acousticus internus and continue into linea temporalis here. Then the anterior root of the arcus zygomaticus or processus zygomaticus continues medially in a transversally placed proeminence. This is called tuberculum articularis, still part of the pars squamosa, behind which we have this depression fossa mandibularis. They together, these two things together, are the temporal components of the temporal mandibular joint. Now, posteriorly, we have the pars mastoidea, the mastoid part, which has obviously this processus mastoideus, the protrusion, medial to which we have incisura mastoidea, and even more medial to it, we will have sulcus arteriae occipitalis, the groove for the occipital artery on this. And as mentioned before, internally, we have on the same pars mastoidea, we have the sulcus sinus sigmoidei. Now, the mastoid part has these little openings that we call foramen mastoideum. This one, for instance, we have foramen mastoideum, which theoretically should allow the wire to pass through and exit through this opening there, which will be eventually the passage for the vena emissaria mastoidea. This time it doesn't wanna let me pass through that. The tympanic part is practically the bony pathway or the bony tunnel which creates the external auditory meatus. So it has a porus acousticus externus and a meatus acousticus externus. I forgot to mention that we have a spina suprameatum that belongs to the mastoid part right above this. Then the tympanic part is inserted between the pars squamosa and pars mastoidea of the temporal bone. So this is how it will create some fissures with these, and these fissures go as follows. We will have the fissure between the squamous part and the tympanic part called fissura tympano-squamosa. Then a fissure between the mastoid part and the tympanic part called fissura tympano-mastoidea. And then we will have this bony plate inserted between the tympanic and the squamous part that comes from the petrous part. To demonstrate that, I'm going to rotate the bone, and as you can see here, we have the petrous part right there, and as I rotate, I end up in this little bony ridge that is practically called crista tegmentalis. It's an inserted part of the petrous part. So here we will have between crista tegmentalis and the squamous part fissura petrosquamosa, and here between the crista tegmentalis and the tympanic part we will have the fissura petrotympanica of Glaser. So this is fissura petrotympanica of Glaser.